Pam. Alan, my name is Yadira Gonzalez, and I'm here to assess your abdomen. I'm first going to start off just asking you a couple questions. I'm just going to go wash my hands. I'll be right back.
Okay.
So, Miss Allen, how are you today?
Good, thank you.
Have you had any difficulty swallowing?
No, I haven't.
Are there any foods that you can't eat because of any allergies or anything like that
No.
you're here today? No? Any recent abdominal pain? Like, at all?
I feel like a fullness in my rectum and my pelvis.
Okay. Do you have any nausea or vomiting?
No, I don't.
How often would you say you have a bowel movement a day?
I'm usually every 4 days, and I feel constipated, and I take milk of magnesia to help.
Okay. Okay. So are you, when you exercise and you drink a lot of fluid, especially water, and including a lot of fiber, like you can have a lot of green vegetables in your diet, it can help you just regulate your bowel system, even exercising. So what is the color and consistency of your bowel movements?
Well, they've been thinner than usual. Brown with a tint of red, but I don't really know if it's blood.
Okay. So have you had any aspirations on your abdomen?
No, I haven't.
Okay. Now, any x-rays ever done?
No.
How many alcohol or cigarettes do you consume a day?
None. I don't smoke or drink.
Very well. Okay, first I'm going to inspect your abdomen, and I just want you to lay down. And I'm going to assess for any symmetry in your abdomen. Everything is symmetrical. I'm going to look for any aortic pulsations. There's no aortic pulsations, no movements that I see. I'm going to look for any distension or bulging in the abdomen. There's no distension. She has a nice flat stomach. So now I'm going to auscultate. Using the diaphragm of my stethoscope, I will listen to all 4 quadrants, starting with the right lower quadrant, right upper quadrant, and left upper quadrant. So right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. So I'm just listening, and she has hyperactive bowel sounds, which is very good. And now you want to auscultate before you even assess, because I don't want to make any noise that isn't there. So now I'm going to just percuss and assess for any tympani in circular motion. And now I'm going to just palpate the abdomen lightly in a circular motion, asking the patient,
Ow.
are you tender?
Yes.
Where? Where is it tender? In the pelvic region.
In the pelvic region.
Okay. So now I'm just going to percuss her kidneys. I'm going to assess any tenderness there.
No.
And I'm going to percuss the liver, looking if there's any abnormalities, if it's bigger than, is it sticking out, bulging, any masses. I'll percuss the bladder to see if there's any urine there. Palpate the liver. I'll palpate the spleen, see if there's any enlargement. Palpating the kidneys to assess for tenderness. The bladder. See if she has any fullness or if I feel anything out of the range. And basically I'm going to just ask the patient, why you're in here today? And she said she was in here because she was feeling a difference in her bowel movement. So I want to educate her. I just want to educate you on improving your diet. We're going to run a couple labs, probably an occult blood, which tests if there's blood in your stool. And then we'll go there from there, okay?
Okay, thank
All right.
you.
It was very nice meeting you. And do you have any questions for me at all?
So you just recommend like diet and exercise?
Yes, I just recommend encouraging all your fiber, more greeny leafy vegetable like kale, spinach. A lot of very good cereals have very high in fiber. It'll say it on the box, high in fiber, so that it can bulk it up, so that you're not having those abnormal bowel movements. So you really just want to bulk up, increase your fiber so that it's not as hard for you to go. And you don't have to be taking milk of magnesia. You want to try to prevent constipation instead of just treating the problem. So we're gonna do a couple studies for occult blood, see if that works out, see what's going on there. And if you have any questions, I'm here. You could just call the office and just ask for Yadira. And it was a very pleasure meeting you. I hope you're having a great day. Okay, take care.